and serves as executive chair and co-founder of Radicle Science, an AI-driven health tech corporation. She's here with Chen, who holds an MD and MBA from UCLA and serves as CEO and co-founder of Radicle Science. Hello to you both.
Hello, so nice to be here. Thanks for having us.
Thanks for having us.
So first, please explain what Radicle Science does.
Of course. So Radicle Science, as you said, is an AI-driven health tech company. So what that means is we generate the first proprietary data set on non-prescription health products, such as CBD and other cannabinoids, functional mushrooms such as lion's mane, nootropics, probiotics, to prove and predict their effectiveness. Our ultimate goal is leveraging this very big data set to transform them into precision medicines.
Now, you mentioned that Radicle Science is disrupting and reimagining clinical trials and research. How so?
So traditionally, trials have largely been small in size, very slow, very expensive, and they're often physically based at a hospital or a clinic. So the only people who end up being in the trial are the people who happen to live within driving distance of these so-called trial sites. And so where each one of those variables I just mentioned, we're going through and systematically changing. So going from small sample study sizes to large study sizes, we're dropping the cost about 10x, we're improving the speed about 5 to 10x. And the way we run our studies in this completely crowdsourced, virtual, direct-to-consumer fashion. And because of that, we're also involving types of people and populations of people that traditionally have not been represented in clinical trials. And it comes as no surprise then that a lot of the data we see in clinical trials, when these products are then used or these drugs are used in the real world, they don't give the same effects that were shown in the clinical trials. So what we're really trying to do is, in addition to making it so much cheaper and faster, we want the data from our studies to be more generalizable, to be more applicable, to be more predictive and reliable to everyday real world usage of these products.
More representative of our population at large.
I understand you recently released results from a first of its kind pain and joint health study. Tell us why this study was so historically significant, and also share some of the top line findings.
Sure. So one thing to realize when it comes to the world of cannabinoids, which is one area that we study, but we're studying all non-prescription health products. But when it comes to cannabinoids, research has been largely banned for the last 100 years because cannabinoids are only naturally occurring in the cannabis plant, which to this day is still listed as a Schedule I drug by the federal government. And so with so little research, yet so many states have legalized cannabis and tens of millions of Americans using these products. So it was important for us to understand these cannabinoids better. So in this study, in addition to understanding how cannabinoids impact pain, this study was looking at 6 different formulations of cannabinoids. There's over 100 different cannabinoids in the cannabis plant. In this study, they were using various combinations of up to 4 different cannabinoids to see if there were any differences in combining these in different amounts. And so what the study found was that in general, across the board, all 6 cannabinoid formulations saw that about half of the people receiving them saw clinically meaningful improvements in pain. Clinically meaningful meaning that this was a distinct, palpable, noticeable improvement in their pain and their associated quality of life.
I know your company also received a Cool Companies 2022 Innovation Award by Connect SD. Tell us all about that.
Absolutely. It was a huge honor that happened just very recently, in the last couple of months. It really is a massive honor to be Cool Company San Diego, not just because, it's great to receive an honor, but especially in San Diego, which has become one of the top 3 innovation hubs in the United States. So it's an ecosystem where some of the best tech, biotech, telecom companies are collaborating with world-class institutions and academia such as UC San Diego. So it's a very, very vibrant entrepreneurship and innovation ecosystem. So to be selected as a Cool Company in this environment, of course, has been an incredible honor.
Now, I've read about how you and your company work closely with UC San Diego, where you're headquartered. Tell us about your work with the university.
Of course. I mean, UC San Diego is, on a tear itself. It's doing incredibly well as a center of innovation and research. So we collaborate very deeply. We have about a third of our company is actually UC San Diego graduates, especially around data science. And of course, that's key to a company that is focused on AI. We collaborate around research. We've just completed a project with them around integration of wearables data. So it's fantastic to have that opportunity to work with a world-class university and to be able to leverage the collaboration to be able to accelerate the growth of Radicle Science. So it's been a win-win for both sides.
And where can people find more information on Radicle Science?
Well, you can check out our website, www.radicalscience.com. Radicle spelled R-I-D-I-C-L-E, which that spelling of radical means the root of a plant. But it sounds radical because that's what we're doing. We're doing things that have never been done before, things that are very disruptive to the status quo. And that's what we're here to do, and to usher in these new health tools by, for the first time ever, demonstrating how these things are effective. Again, these are medicines and products that are inherently democratized. They're very difficult to patent. They're very difficult to monopolize. You don't even need a doctor's prescription. But what's missing is data on their effectiveness, and that data is preventing them.